Close to 100% of long-term care residents have already been vaccinated, and yet their lives have not changed. Most still can't leave their homes or just go outside for a walk. And many, doctors included, are saying it's time to let them live again.
I know that the powers that be feel they're trying to keep us safe. And that's all well and good, but if you're not having any quality of life, is it worth it?
I haven't seen fresh air except to get in and out of an ambulance in over a year.
Sharon lives in a long-term care home in Newmarket. Carolyn is a resident in Keswick. They are part of a provincial resident association and are speaking on behalf of thousands of seniors. It has been a year of unbearable loneliness, trapped in their rooms.
It's not easy. And we feel, I think most of us sort of feel that we're being punished for this pandemic, and we've had nothing to do with it.
Both have had their second vaccines.
Do both of you feel safe now that you've had your second shots? Do you feel that you are protected from COVID?
Yes.
Yes.
The numbers show they should feel safer. Vaccines have caused long-term care cases in Ontario to plummet.
Our own data, if you want to talk about data from the province's COVID-19 Science Advisory Table, showed that the vaccine has been really spectacular in this population in terms of reducing the risk of the risk of cases and also the risk of deaths. 96% reduced risk of death.
And yet, very little has changed inside the homes. Only now, they say, they can sometimes go to a virtually empty dining room.
It's been basically my room until recently. In my home, I'm able to go out into the hall, masked.
Even with concerns of a third wave and variants rising, doctors say it's time to ease restrictions.
We absolutely know that we have to balance the risk of COVID-19 versus the risks of social isolation. Social isolation is also a killer.
But what is the right balance between protecting residents and allowing them a life worth living? It is a question the Associate Medical Officer of Health addressed this week, admitting it's not an easy answer.
That is a question that's very much under discussion currently, both within the Government of Ontario, but also across the country.
Both Dr. Stahl and Dr. Arya say the time for discussion is over.
The effects of the public health restrictions we've imposed upon these individuals are extreme, right? And we've seen collateral damages over the last year where people go from being able to walk to no longer being able to walk, from recognizing loved ones to no longer recognizing them.
I don't understand why we can't take people out for a walk.
Sharon and Carolyn miss their families, seeing a smile without a mask and the feel of the sun.
Can you imagine a resident going for a little walk and coming back covered in blankets? How much they would appreciate that.
No government wants to open restrictions and have COVID strike again. It's an understandable fear. Close to 4,000 seniors have died in this province in long-term care. But time is especially precious for those residents and for those families who want to see them.